Okay, the stand hasn't arrived yet, so here is the first study video. I'm going to hold the camera in my hand, and it is going to be inevitably shaky, but it is better than not starting my study process the day that I set myself off to start it. So I was thinking for general anatomy, I'm going to use this dark blue color. And there it is. The way this is going to work, I'm just going to outline and say the topic and reconfigure the words in a way that makes sense to me, so that I can play this in the background while crocheting for a second study and then make flashcards for the third study. All right, introduction. Anatomical position. Body is facing forwards. Arms full extended, palm forward. The body can lie in these positions. Prone is down and supine is up. Regions of the body. Cephalic is head, caudal is tail, cervical is neck, thoracic chest, abdominal, between chest and genitals, lumbar is lower back, sacral, it's over the sacrum. That's pretty clear. Surfaces of limbs, dorsal, where the fin would be, or the back, and ventral is front. All right, various planes in the body. We've got, I know the lighting is terrible. It's just gonna have to work for this first video until the stand arrives. All right, various planes in the body. We've got horizontal plane, so it's in line with the horizon, but it's also known as transverse. Transverse and horizontal are the same. Vertical is up and down. Right angled horizontal. Sagittal, top to bottom, separating left and right, but not necessarily in the middle. Sagittal can be anywhere from top to bottom, separating left and right. Coronal is a vertical plane separating back from front. Median is in the sagittal plane. It's the very middle line. Medial is close to midline. Let's see if we can clarify median and medial. So medial is toward the midline, and median is midline. Lateral is away from midline. And here is the illustration. Okay, next. I did not remember to set the timer this time because I was focused on holding the camera, which is not going to be a long-term plan here. All right, anatomical terms related to movements. We've got flexion towards the trunk, extension stretched away from the trunk, adduction toward midline, abduction away from midline, supination turned upwards, pronation downwards, medial rotation in, lateral rotation outwards, ulnar deviation towards ulnar, so towards ulnar, radial deviation, radial. Meaning of the following anatomical terms. Oh. Proximal. Closer to the origin of the limb. Distal. Further from the origin of the limb. Superficial. Surface. Deep. That's self-explanatory. Cranial is head. Caudal is tail. Palmar. Holding part of the hand. Plantar is the sole of the foot. Superior is above, inferior is below. All right, that is the first video, but because it was so brief, I feel like it's okay to keep going with the histology anatomy. So we're gonna just keep going. That's why for the next video, we'll remember to set the timer for 10-minute blocks. Okay. Because we're still in anatomy, I'm going to stay with the blue pencil even though we're getting into histology, because I don't want to use 70 different colors for this book. So as long as we're in the anatomy section, regardless of the subset, I will stay with blue, dark blue. Histology, intro. Cells, classification. Epithelial, smooth muscle, skeletal, cardiac. Those are all types of muscle cells, nervous cells, bone, blood, connective tissue. All cell types can be replicated except cardiac and skeletal muscle and nervous tissue. Except cardiac, skeletal, muscle, and nervous tissue. No replication. All right. Types of epithelia. We have squamous, which can be either simple or stratified. Simple is usually lining lymphatic, blood vessels, pleural, peritoneum. Stratified is usually in places like skin, esophagus, and the lower half of the anal canal or colon. Stratified is usually in places for protection. Simple is usually in lining areas. Pleural, peritoneum. Okay. Cuboidal is in Bowman's capsule, convoluted tubules of the kidney, and thyroid follicles. Oh, I didn't know that thyroid follicle one. Columnar has several types. Simple columnar in the epithelia is lining of the GI tract. Stratified is uterine tube, aka the fallopian tube. Pseudostratified is in the respiratory tract. Alright, looks a little squashed and stretchy. Transitional is in the ureter, the bladder, and most of the urethra. Here are the types of epithelia. Squamous, cuboidal, columnar, transitional, pseudostratified, columnar, stratified, cuboidal, stratified, squamous. Squamous means flat. This is anatomy and embryology. Embryology introduction. The body develops from an embryo, which at the end of the second week has 2 layers or is bilaminar. At the end of the 3rd week, so day 21, it has 3 germinal layers or trilaminar. The endoderm lies on the inside and gives rise to respiratory tract, gastrointestinal tract, and bladder, except the trigone. The ectoderm lies on the outside, gives rise to the... Is that focused? Yeah, okay, good. Epidermis, including hair and melanocytes for ectoderm, retina and lens, brain, spinal cord, and nerves, pia, arachnoid motor, adrenal medulla, autonomic nervous system. The mesoderm lies in the middle and gives rise to paraxial mesoderm, which includes vertebrae, muscles, dermis, and dura. The intermediate mesoderm, which is kidney, ureter, and trigone of the bladder, and the reproductive system, and the lateral plate mesoderm, which includes cardiovascular system, including lymphatics, spleen, respiratory system, adrenal cortex, thyroid gland, appendicular skeleton, and joints. And that is our first 10 minutes left. So we stop.